Hi everyone, I'm Erin.
And I'm Rochelle.
We'd like to talk a little bit on the topic addressing our medical provider team and everybody who is in that English-speaking group side of the folks that we're interpreting for. So this one's for you, everyone. We have gotten some feedback and in our own experience as well that sometimes providers don't always know what to expect or how to work with interpreters. So we thought we'd pick out 3 of the critical or kind of key core skills and things that professional interpreters will do and highlight that a little bit and unpack it for you so you can get inside the interpreter's brain and what they're thinking about. So the 3 things that we're going to highlight, and I know interpreters, there's a lot more than 3 things that we do in the skills that we bring to the encounter, but the 3 things that we want to take a look at are with regard to positioning, our use of first person, also called voice of the speaker, and the third one being why it is that we interpret in consecutive mode. Okay, so first off, with regard to positioning. For an on-site interpreter, this is actually pretty strategic. There's a lot of thought that goes into where it is that we're putting ourselves in the room. For example, we are keeping in mind how is it that based on where I am located physically, will I be able to allow the patient and the provider to have access to each other and all of the things and equipment in the room that they might need, a sink, a sharps disposal, all of those extra additional things in the exam room that people take for granted. Where can I be so I'm out of the way of all of that and let the patient and provider have direct access and communication to each other. But I also want to think about how can I facilitate communication effectively in this environment?
Right. You have to look at crying babies, for example.
Yep.
Or siblings in the room,
Yep.
maybe, if you're looking kind of at that pediatric family practice. Physical therapy, where are the machines? What's your background noise? Family members, so the 2 chairs next to the desk are taken up. So where are you going to go? How big is the room? Labor and delivery might be what mom's hearing with all of the things in the background. Patient speaks English, parent doesn't.
Mm-hmm.
So where are you going to sit and do things like that? So it's definitely all about kind of hearing. And interpreters use positioning to manage the flow of communication, which is really important. So there's a lot of critical thinking and strategy put into where, even in a small space or large, they're sitting.
So keep in mind your interpreter is thinking about that aspect. Okay. In addition to that, then another skill and technique that we're bringing to the encounter is using first person or voice of the speaker. That basically just means that whatever you say in English, I'm going to, as a Spanish interpreter, say that exact message, that exact meaning, as if I were you speaking. Funny story, true story. One time I got feedback from an English-speaking doctor who said, "Wow, you sound really eloquent when you're speaking Spanish." And my thought and reply back to him was, that's because you sound really eloquent when you speak English. Right? So
yeah.
That's, part of the reason why we're using first person is so that we can be really authentic and let your voice be heard by the patient.
Mm-hmm. And what's happening for an interpreter is when we use first person, it's really allowing our memory recall and skills, cognitive skills that we have to use to do our job to work easier. If you're having to take, when you say, well, I want to know if you have, and the interpreter has to cognitively switch that and say, he said he wants to know if, it's not matching the message. And so there's a lot of different things cognitively that's happening in an interpreter's brain that's needing to break that down. But then also, that it is the exact message. So if a patient is angry and tone and register, and we'll get into that in a different video, but all of that's taking place, and so when it's first person, it starts to make it very real and that you're talking to your patient. And so what'll happen as well, oftentimes, is that when it's the first person and you're hearing that back and forth, the dialogue will sometimes start looking at the interpreter, right? So you're talking to the interpreter talks to the patient interpreter, that kind of thing, triangular. But when you hear first person, it's very common that you'll start to look at your patient, and the interpreter will kind of fade into that background. So we have the positioning, but then with that first person, the interpreter fades into the background, and it helps you to really build that rapport with the patients and their families.
Yep, so it's your encounter, it's your appointment with the patient and their families. So the last part of the skill that we want to highlight for this video is the use of consecutive. Consecutive just means that we don't interpret at the same time as you're speaking or at the same time as the patient or family is speaking. There's a variety of reasons why we do this, but one of them is not because we're trying to drag the appointment out longer.
Right.
Another reason is not because we're not skilled enough to do simultaneous interpreting. We certainly can do simultaneous interpreting. In other words, interpreting at the same time as you're talking. The reason for consecutive in the medical setting is it tends to be a dialogue, right? Because it's not just one person addressing a large group of people. There's an exchange of information, a back and forth, question and answer, or even going into a story. So when you're in the consecutive mode as the interpreter, it really is helpful to increase accuracy, and there's some information and studies that suggest that consecutive actually is a more accurate way of interpreting. But in addition to that, it really helps the listener.
Yes.
As interpreters, we're thinking about not only reproducing the speaker's voice, but how is the listener, whoever that happens to be, and sometimes it's you, the provider, and sometimes it's the patient, right? Because there's the exchange of dialogue and information. But if Rochelle were sitting here talking and maybe at a quieter voice and maybe in a language that you don't understand, that would be really distracting to you trying to listen and focus on what my voice is. So that is one small reason, but important reason why, as interpreters, we're using the consecutive mode in a medical context. It helps the communication be more clear and more effective.
Yeah, and it also, as a provider with the consecutive, the consecutive isn't for you to necessarily take a break, right? It's not for you to be like, oh, okay, well, the interpreter is talking to the patient, so I'm not going to pay attention to that part because the interpreter will come back. It's still really important to observe body language and length of message and all of those things. So as a provider, it's not a break. The other thing that's important to note is with that first person and with consecutive, there's a really smooth flow of communication, and it kind of helps to, not kind of, but it helps to make the appointment run very efficiently. And so you might, like Erin had mentioned, having it maybe last longer. It really doesn't, because it really starts to go back and forth with all of these different things that we're talking about today.
So just wanted to highlight those 3 things for you, let you get inside the interpreter's brain and see all the different activity, or a glimpse of some of the different activity that's going on while the interpreter is also, oh, by the way, interpreting the messages. So thanks so much for taking a look at this video. We'd like to hear your feedback and comments and maybe some insights or anything that might be helpful for us to learn from you as healthcare providers working with interpreters as well.
Right, so thank you very much for watching our video. If you'd like to see more, be sure to subscribe, and we really look forward to your feedback. Have a great day, everybody.
See you soon.